Hello, everyone. It's 3:30. Thank you for joining us. I am Janet Hill, the Chief Operating Officer at the Rock Island County Health Department. Today, our team does not have prepared statements, but we are here to answer your questions to the best of our abilities. We are joined by Nita Ludwig, Administrator of the Rock Island County Health Department, and Ed Rivers, Director of the Scott County Health Department. As always, please type your questions in the chat box. The question and answer section will be moderated by Brooke Barnes of the Scott County Health Department. Today in Rock Island County, we are announcing 5 new cases of COVID-19, bringing the total to 16. Ed, what are Scott County's numbers?
Today, 2 new cases were announced for a total of 18 in Scott County. Additionally, in Iowa, there were 73 new cases for a total of 497. Also shared was that there were now 6,788 negative results.
Thank you, Ed. As Nita mentioned, we do not have prepared statements today, so we would encourage you to put any questions that you have into the chat. Looks like we do have our first question here, so we will get started with those now. Would it be possible for you to gather information about the number of confirmed COVID-19 patients who are being treated in Quad Cities hospitals? We'd also like to know if they're on ventilators and how many the hospitals have.
We can only provide the information that is announced by the Iowa Department of Public Health.
Nita, how is that handled in Rock Island County?
Hi, I am just looking at our numbers here right now, and it looks like five of our current cases are hospitalized in local hospitals. As far as ventilators go, I have no information on that at this time.
Thank you. If someone has to go out in public, should they wear a mask just in case they have COVID-19 but don't have symptoms, or should those masks be donated to medical facilities? Ed?
Well, as Dr. Katz said when he spoke on this call, it is the symptoms that produce the infectiousness, the cough, the sneeze, those droplets in the air. And for a symptomatic patient, a face mask helps protect others. But for a person who is not symptomatic, it's not protective to wear a face mask. And if you have a cache of them, our EMS providers would love to have them.
Also, if a person doesn't have a mask, do scarves or other things around the house work to keep your own contagiousness down?
It would certainly be better than nothing if one is infectious.
When might the QC see its peak of cases? Nita?
Sure, I think this question came up yesterday as well, and at this time, there is really no way to predict the peak of the cases. There are a lot of different models out there that say sometime in April, Illinois will hit its peak, but to pinpoint a date, I don't think anyone can do that at this time.
Thank you. It looks like we have a follow-up question to the question about those who are hospitalized and on ventilators. Does the IDPH have that information for Iowa?
I don't know how granular their information is. They release what we're able to announce to you on their website.
And that's on the Iowa Department of Public Health's COVID-19 page. What can we do if we know someone is knowingly defying their quarantine, or if we see a crowd gathered? Do we call health department or police? Nita, do you know how that works for Rock Island County?
Yeah, I don't think they would call the health department. We really don't have any jurisdiction over crowd control. So that's all I can really speak to that. I can't speak for police.
Do we know how that's handled? We could start with crowds in Scott County if there's individuals over 10 gathered.
Yes, as you know, the governor, the proclamation dealt with gatherings of over 10 or more. So if you are aware of an area where this is happening, perhaps a city park, reporting it to the city might be in order. I know that the cities are taking some measures to help keep that down, like removing basketball goals. The Scott County Conservation Department is putting up snow fence around congregate areas to keep it down. And we're hoping that people, as the weather gets warmer, will not begin to congregate outside.
Thank you. Are we entering a
I
period?
will just add a little bit to that. So again, the elected officials and the mayors from both sides of the river have been working together on these. So the parks on the Illinois side, they have had similar barriers put up in some of those playgrounds. But I would add that, you know, just from my route to work and home, I haven't seen large crowds gathering, so I'm not sure if that is an issue at this time.
Thank you, Nita. Are we entering a period where numbers will start to spike until peaking April 18th, including positive tests and even deaths? As that relates to, do we know when the peak is going to happen in the community?
That's so difficult to determine. I was reading an article that the mathematics of life and death, and one of the quotes in that was, all models are wrong, but some are useful. So predicting when the peak might be is beyond my capability.
Do you have anything to add to that, Nita?
I'm sorry, could you repeat the second part of that question, because I didn't catch it.
Are we entering a period where numbers will start to spike until peaking April 18th, including positive tests and even deaths?
Yeah, what I think I would have just added to that is that we certainly are seeing the cases increase in Rock Island County, and I think in Scott County as well. But again, no one knows when it will peak and decline, but hopefully with the actions that we're taking, with being diligent to wash your hands and social distance and stay home when you're ill, that will be flattening that curve so that we can see a decline as soon as possible.
The next question, yesterday, Dr. Fauci at the White House Coronavirus Task Force briefing predicted another coronavirus outbreak in the fall, but also said the country should be better prepared. Are the Quad Cities doing anything to look ahead to the future, or is all focus and resources being spent on the current spread of the virus? Nita, do you want to start with that one?
Sure. Well, we are trying to allocate the resources, as we talked about earlier with masks and our emergency management agency, trying to respond to the current situation we're in, but certainly we are looking forward to the future to see what we need to think about. We spoke yesterday about the emergency management agencies looking at possible alternative treatment sites if they might be needed. And in public health, certainly we are looking ahead farther down the road, even that sometime in the next year or whenever the vaccine is available, that public health will have to be involved in the vaccination clinics that will be needed to get people vaccinated for the coronavirus.
Thank you, Nita. We'll give it another 30 seconds or so. Please add in any additional questions that you have into the chat. We have an additional question. What are the EMAs, the emergency management agencies, and command center doing to help prepare for more cases? Ed?
On the Iowa side, our EMA is working with the health department, the medical facilities, other facilities in the community, marshaling and guiding those facilities and resources, and planning, as Nita said, for the long term, making sure that we do have the resources to last through this outbreak and another wave should it present.
I have another question, and Ed, perhaps you can respond to this generally speaking. Of the confirmed cases, are you learning how they were exposed? Is this perhaps a loved one, workplace, social gathering?
We don't have that information.
Nita, question for Illinois residents based on Governor Pritzker's press briefing that he just provided, that they're staying put until April 30th with kids out of school too. How much do you think that this will help?
Well, I think that this is a precaution, just as we heard from the White House the other day, to extend it out till April 30th to continue to try to flatten the curve and make sure that the healthcare resources are there for those that get more seriously ill who need them. So I think just by lengthening out to the end of April, they are hopeful that they will flatten out the curve.
Oh, you mean?
The next question, is the curve flattening yet? Ed, do you have feelings on that? I know the question was brought up yesterday as well.
Since we have relatively few cases in the Quad Cities, it's hard to determine, but again, a good visual representation of the curve can be seen on the Johns Hopkins site. It appears to be still trending upward, but you can judge for yourself.
Another question, do we have any tracking points in place to contact people who may have been exposed by those who have tested positive so they can quarantine and not continue to spread the virus without knowing that they may be infected? Nita, do you want to talk about this as you discussed yesterday with what public health staff does in terms of contacting positive cases and doing some of the follow-up that way?
Yeah, sure. That's exactly what they have been doing. So when we have a positive case, our nurses in our infectious disease department, they do that. They contact anyone that person may have been in close contact with. They're trying to determine where that person's been, what kind of a group they may have been in. And by now, people aren't gathering in large groups, so that should be very helpful. But they are going back to try to determine if any other people have been exposed and to make sure that they monitor themselves for any signs or symptoms.
Thank you. Do you have any information on what the most common form of transmission is, whether it's between family members or catching it from a more public place? Ed?
Well, I think we can say that the cases that we're seeing now are examples of community spread, whether it's from family members or catching it in a public place. We all need to remember our social distancing, even within families. Wash your hands, cover your cough, cover your sneeze. The more you use those techniques, the less likely you are to acquire the virus, no matter the source.
We have an additional question that may be for the hospitals, but do the health departments have an idea of what the bed capacity is in the Quad Cities area? Do you know if this area has adequate resources, ventilators, personal protective equipment to fight the virus as it spreads?
We don't have direct access to the information, but I know that the hospitals are working on this issue, working on their surge capacity plans, and they may have an information release in the coming days about the items that you're interested in.
Thank you all for participating today and having your questions answered by Ed and Nita. We appreciate your assistance in getting this information out. We do anticipate having an additional call tomorrow at the same time. We will be sending you out that Zoom information. We do anticipate having prepared statements, so there may be some additional information coming your way. But in the meantime, we encourage you to help our community find additional resources that would be helpful through the Iowa Department of Public Health, Illinois Department of Public Health, the CDC, as well as both of the health departments for Rock Island County and Scott County. So we encourage you to link to those as you're doing your stories, and that would be helpful to get information out to the individuals in the community. Thank you.